I'm Dr. Jake Irwin. I'm a physical therapist, and
I'm Amanda Stillings, the Chief of Operations at Pro Performance Therapy.
So we're here with our first episode of what we're calling PT Versus. So the idea is that we're going to talk about physical therapy as a treatment option versus other things that you might see people do, but not so much in today's episode. Today's episode, we're going to get into more questions that people ask us about physical therapy and about how that relates to other professions.
Yep. So these are common questions, comments, suggestions from, anywhere, like PT students, our patient population, the internet, all that fun stuff. So the first thing, I'm a certified nutrition. I'm not a dietitian, but I am certified nutrition. So the first thing that, people get, and you get asked this all the time, should a physical therapist learn about nutrition and start giving out nutrition advice?
So actually, the way that Amanda phrased that question, I'm more okay with than how it usually is dealt with, which is, should they learn about it and then give the advice? Sure. If you want to take the time to learn about it and then give the advice, I think that's fine. My personal take on it is that I have plenty to keep up with from the literature point of view and science point of view, just within the realm of physical therapy, and really just within the realm of outpatient orthopedic physical therapy. Like, I can't do all things physical therapists do, even as a licensed physical therapist, let alone step into a completely different realm of science, a completely different profession. What I know about nutrition is what I hear about from news articles and radio ads and things like that. I don't want to use my credentials as a physical therapist incorrectly by giving advice on something that's not my area of expertise. And I don't want to take the time, and I don't think most PTs do take the time to become experts in nutrition, because we have to spend so much time staying experts in physical therapy.
Yeah, so the field of nutrition, I think that it's one of these things that everybody just assumes that it's easy to do, and it's not, for 100 reasons why. The field of nutrition and nutrition science, like, there's literally medical doctors that study this. And that means, when I say medical doctor, they're doing school, they're doing their residency. This is not just, I have a few certifications, and it took a hot minute to do those. So I probably know a little bit more than Google does, to be quite honest with you, or how to interpret that information to give to people. But I think people just think it's easy, and it's not. And there's so much misinformation out there. And there's a ton of stuff about nutrition that we just don't know. Like, in general, one reason, like, with all this diets and saying things that are like definite things that people need to do, is not necessarily the truth. And that is all in its infancy on studying diets and how your genes react to said diet. And that is, like, it's such a mess out there right now with all of that. So if you want to go ahead, PT students, if you want another 8 years of school to do that, and some of you might, and that's cool.
Right.
Otherwise, like, if you did want to be a little bit more, being able to be more discerning about the information that you can give to your patients if they do ask you questions, and go get some sort of certification that, it's going to cost you some time and some money, but it's not, it's not going to be another 8 years of school to do that.
So if this were a PT versus nutrition, I would suggest that as a PT, I'm not educated, extensively in nutrition. I took an undergraduate class in nutrition. That's the last time I've had any education on it. And I don't even want to say how long ago that was.
Oh, come on.
So just, not to say that you can't give some limited, reasonable advice, like, avoid, excess sugar or inflammatory things like alcohol, but not to try to give somebody a prescribed diet unless that's an area that you've actually received a lot of education.
Yeah, and it's out of your scope at that point too.
Right.
So you have to be careful with that.
I think that's a bit much. All right, what's next?
All right, so moving on from all that, this is a completely different change of subject, but I don't know if anybody, we have like 2 YouTube subscribers, but anybody, we're going to work on that. But anybody,
one of them's probably my mom.
Oh, one of them's definitely me. So there's that. That if you do follow any of our social media, we're big advocates of people shopping for their healthcare and understanding that, and just being an educated consumer, because people, for some reason, there's this big disconnect that you are a consumer of healthcare services. That's just how our system is right now. So we get this post all the time that people are like, you guys always post on your social media and advise people how they should shop for healthcare. How should I go about shopping for healthcare provider?
So the same way you shop for anything else, right? So the only difficult part is that you can't really get pricing and quality information from the internet, right? So it's not like you can go on Amazon and compare prices to your local physical therapy provider, but you can call around. And it's worth it. I'm the last person. I don't want to have to call around to a bunch of places and ask them how much it costs and what I should expect. But it's a difference of probably thousands of dollars, right? So if you go to a hospital-based outpatient physical therapy practice, and when I say hospital-based, it doesn't mean it's in the hospital. It means it's owned by the hospital, or sometimes they just have a contract with the hospital to do the billing. So they might be just in your local grocery store parking lot, and you're thinking it's just a regular clinic, and you're getting charged hospital rates, which can be 3 to 4 times as much. So it might be $400 a visit for your physical therapy that you're expected to go to 2 or 3 times a week. It's worth finding out whether or not that's what it costs. So call up and say, what would a typical visit look like? What should I expect to pay on my first visit? I have this much deductible. Can you tell me something about it? Now, you should also go to your insurance company's website and see what they say.
You should. And so that kind of follows up with the next question here is like, how do I know what my insurance covers? Because we get that too. And it is shocking. And all of you watching this too are going to be like, oh, I'm supposed to know that? Yeah, you should know that.
It's your insurance.
It's your insurance. So, for the most part, it was pretty cut and dry because we're just dealing with one specific benefit, which is, physical therapy. Now, it depends on when we go back to the hospital or is it a private office setting. There's 2 different things. So there are a lot of things that you have to kind of understand what you're looking for, which would be something to ask a provider for help for. But, there's nothing more annoying than asking a provider to check your benefits, which they may or may not do, but it's literally something you can just do yourself. And you need to understand that.
But it's probably easier for you to do it because one of the things you got to keep in mind is that the insurance company doesn't work for us; they work for you, right? So they're responsible.
That's debatable.
Technically, in most cases, they work for your employer.
Exactly.
But they're closer to working for you than they are working for us, right? They're who pays us. So if anything, we kind of work for them. So they don't feel any responsibility in telling us anything. Even if we get pre-authorization, like in a pre-authorization form at the bottom of it, it says pre-authorization does not guarantee payment. So just because we've done our legwork doesn't mean anything about what we're going to get paid or which party is going to pay us. So you need to look that up yourself.
Yeah, well, the only party paying for anything is going to be you.
Yeah.
So your insurance is not a payer. The government's not a payer. We all pay for it one way or another. So that's something that might blow your mind, but think about that for a minute. Another thing, I'll go back to, we went over how much do I know what my treatment costs. That means just, we went over the hospital rate, or another thing you could call that, it would be a facility rate versus a private practice because those numbers are going to vary differently. I've run into people who are like, what? It's just not all the same. I'm like, absolutely not. Even, especially when you get insurance involved, it's not all the same. Same service, completely different fee schedules and out of pocket.
You can have 2 people standing in your office doing the same thing with the same providers, and one of them is paying a completely different amount than the other one because of their insurance contracted rate.
Or if they're cash.
It's a messed up system, but that's where we're at right now.
Exactly. So to go back to shopping, one thing I would want to say about that, so you don't get overwhelmed, like you do anything else. Like if you're going to go to a mechanic or do something with your car shopping, etc. Find 3 places, maybe something that maybe your doctor did refer you to go check that place to. Mm-hmm. Check 2 others.
Yep. Ask friends, and don't rely super heavily on Google reviews because those are bought and paid for largely.
Yeah, except for ours, we don't.
Well,
do that.
ours are all real people, but
that is true.
We've had offices open up, and within a week of them opening their doors, they've got 60 Google reviews, and I'm like, there's no way they saw 60 new patients in that week that they've been open. So just don't rely heavily on Google reviews. And if you look at Google reviews, look at the negative reviews. Look at whenever I look at Google reviews, I always want to see what the 1-star reviews are. And oftentimes when I see that, they're like, oh, I didn't feel it was fair that I had to pay for that service. And it's like, well, okay, I understand that some people are not going to be happy about what they had to pay for. But if they're like, I was seen by an aide, or I was seen with 4 other people, and you see that consistently through their negative reviews, it's probably not a place you want to go.
Yeah, agreed. It is crazy because we've definitely had a few places open next to us, and I mean, literally within like a month, I'm
Just
like,
immediately, way
Okay.
more reviews than they could have possibly seen. New people.
and all 5 stars. I mean, we have all 5 stars, but
Yes.
we have like what? How many reviews do we
That's
have?
20 something. It's
Right,
not,
but we
it's
used
not
to
a ton.
have tons because we had different locations. We just have the one now. Thank you, COVID. But yeah, you just have to take a lot of that with a grain of
So
salt.
ask neighbors,
Word of mouth.
call around, check their Google status. So ask for input from people. I wouldn't necessarily go on Nextdoor and ask, because Nextdoor is kind of, it's a little crazy.
A little.
So, but just ask around. I think that's a perfectly reasonable way to shop, and then call the office and ask what the service is going to be like. So not just how much is it going to cost, but what should I expect, right? So am I going to be treated, like I said, earlier, being treated by an aide? An aide is a non-licensed person. They're not actually supposed to do anything regarding treatment in the state of Georgia. So they can't supervise exercises. They can't apply hot packs and cold packs, things like that, that they're commonly being asked to do. So ask around and see if that's what's happening at the clinic that you're thinking about going to.
Yeah, so that actually kind of leads us into this next difficult thing that we need to educate people on, and because people don't know what they don't know, right? But as you just mentioned, especially in each state has its own rules, but I think pretty common is being treated by an unlicensed person, which in a practice might be a physical therapy aide or a tech, depending
They
upon.
sometimes call them techs.
And you can go off about techs.
Well, so the term tech or technician in the state of Georgia isn't legally defined. The only thing that's in our law is a physical therapy aide. So even just wearing a name tag that says physical therapy tech or technician is technically against the law in the state of Georgia. They all do it because most of these corporate practices are across multiple state lines where the term technician is applicable. And they use it because the licensed personnel are physical therapists and physical therapist assistants. The physical therapist assistant is often coined, or the term used, as a PTA, and it's really hard to distinguish when you hear the word PTA versus PTA. Like, it sounds very similar, so they just go with tech so that it doesn't sound so similar. Honestly, the state of Georgia just needs to update its language, include the term tech, but those are still unlicensed people and they're still not allowed to provide any treatment.
But we know that they do,
Oh, we know that they do.
and you have to be careful about that. So who can provide physical therapy? Well, I will tell you this regarding your insurance. And we've read a lot of contracts to kind of research some of this. They will tell you, and the same thing with medical providers. It's got to be a licensed practitioner. So that bleeds over into your personal trainers. They're not physical therapists. Now, sure, could you be a physical therapist and a personal trainer? Sure, you could. But just a personal trainer cannot tell you that they're providing physical therapy or a treatment, period. That includes, like, who else like bleeds over into that?
So, like a chiropractor can't perform physical therapy. And this was a big thing a while ago. I haven't seen it as much recently, but chiropractors would take a weekend course on what they called physiotherapy modalities, meaning that they would learn how to use e-stim and ultrasound, and then they would say they were providing physiotherapy. And again, in the state of Georgia, physiotherapy, physical therapy, PT, DPT, RPT, MPT, those are all protected terms. No one else is allowed to use them unless you have a license to practice physical therapy. And we know that like a big fitness company has recently had all their personal trainers wearing t-shirts that say Dynamic Personal Trainer, DPT. And that's illegal in the state of Georgia, but it's a national company, and they've done it all across the nation. So it's making prosecuting that, or at least getting them to stop, a little more difficult.
And gosh, how convenient that they did that.
They knew what they were doing.
They knew what they were doing. So who can provide it? So we've got an actual physical therapist, which now for the last how many years? It's a doctor of physical therapy. So DPT.
For 10 years now.
But there was master's program a long time ago. Those would be some of your seasoned PTs, but then MPT. So then you have a physical therapy assistant, also a licensed practitioner, and then you've got an athletic trainer.
Athletic trainers can provide rehabilitation, and they often work in offices that are owned by physicians, because then they bill under the physician's license. The reason for that is that, for whatever reason, athletic trainers billing under their own license, a lot of insurance companies won't reimburse them, or they'll reimburse them at a much lower rate.
Correct.
So you don't see them as often in the corporate practices or the private practices. But I personally work with a lot of athletic trainers, and they're very smart, very educated people. But they're not providing physical therapy. They can do rehabilitation, which sounds like the same thing, but they can't call it physical therapy.
Well, I think the best way also to determine like
any more than I could call what I do athletic training.
Right, exactly. It's different, but like an athletic trainer is kind of like your first responder. So like if you're like, playing sport or like football, like something happens there, whether it's like somebody gets hit in the head, or they sprain an ankle, they get the wind knocked out of them, the people that are running over to them, besides probably coaches and staff, is going to be the athletic trainer.
Yes.
So those are carrying people out. Like that's what they're doing. So you're like, you guys are just doing all this. You're like, I don't get it. And we'll provide show notes on this too. But if you're trying to find out, like, we've had to do this, it's come up. I've definitely heard people or read, some people are so blatant about it because I don't think that they either know they haven't been turned in or they don't care, that they'll say that they're PT, or the same thing happens to massage therapists too, that how do you know, like you heard somebody, oh, I go to so-and-so, well, they're not really this, but you're like, well, that's weird. So how do you find that out? If you have somebody's first and last name and you just go to, and all states have this too, and all states have a governing licensing body, you go to the Secretary of State website, put in their first name, last name, any version of it you think, and you can search those people, and you would be shocked at some of the stuff that you find. Either these people don't exist because they're not licensed people, or they've been suspended licenses, and that's always super fun too. And
that takes less than a minute. Like you can very easily just Secretary of State's office, physical therapy,
licensee search.
One of the first things on the first page is licensee search.
Yep,
and very easy to find.
You can also search entire. There's facilities out there too that have to have licenses. You can search that if you're ever concerned about that. But like honestly, you definitely need to check that out. If you, anytime you go into a place, we've definitely opened offices and gyms, and sometimes it's hard how that kind of can bleed over. And that's when that would be the first, or an environment where you're like, I probably need to check this out and figure out who was doing what to me at this particular time.
Technically, if they're working in the PT clinic part of it, they're supposed to have a name tag on that identifies them as the licensed provider. Anybody that's working with patients is supposed to wear a name tag. And I say that, and we often don't wear name tags because everybody that's providing services in our office is a licensed physical therapist.
But also what we do and what everybody else is supposed to do is your license
is posted where people can see it. Yep.
And they're not really pretty anymore. They used to, but Secretary of State did something dumb. Anyway, but regardless, if anybody needed to do a quick check and they didn't see a name tag, they ever know everybody's name. So they can go up and look. And it's very easy for them to go look and see what's current to match it. And I mean, you're just kind of supposed to do that. So, so what is, I'll ask you this because you can answer. So like, what would somebody do if they find out that, oh, I've been going to such and such, and they've been saying that they're doing all the stuff, and maybe they did get injured, or they're not getting better, or they're just like, this just seems odd, and they find out that the person they're working out with or doing whatever isn't licensed?
Super easy. So right there on that same Secretary of State's website, right next to license search is like report a violation. You click it, you've put in the information about what you saw. You do have to include your information, but that information never gets reported to the person that you're turning in. So it's anonymous from their point of view. So the only people that'll know about it is literally members of the state board. And they will, and if you're worried about like, well, I like them, I don't want them to get in trouble, all that will happen is that they'll get a cease and desist order from the state board saying, you're doing this thing and you need to stop doing it. You're representing yourself as a physical therapist or as an athletic trainer or as a physician, and you're not one. So stop doing that. And then that's all they do. They just send a cease and desist order. And then they follow up in a couple months and look back at the website, or go by the facility or call the office and find out if they're still doing it. And if they're still doing it after they've been sent the cease and desist order, then they can get fined. And then, if it persists, they can have legal action taken against them. But for the most part, it's really not harmful to them. It just makes them stop doing the thing that's illegal that they've been doing.
Yeah, or just
don't say you're something you're not.
Correct.
And it's not complicated.
If there's a trainer out there or something that says that this same thing goes with nutrition too.
Yeah.
Like I can't tell you how many times that people will put that they're dietitians. They're also licensed providers as a dietitian, and they're not at all, not remotely. Yeah. So it also depends on where they get a certification. Like I know where I got mine. I'm listed in this database. So if anybody was like, I need to check that they could go look me up in that. So That's how that works. And we're not trying to like get anybody to turn anybody in, but it's a matter of safety at this point.
Yep.
And we've definitely gotten patients from.
I had a patient this week that got hurt by a device that was being used by a non-licensed person. Now, in this case, it's kind of weird because they're not presenting themselves as being licensed. They're literally say that they do exercise therapy, and they point out that they're unlicensed, essentially technicians, just applying these treatments. But the treatment they used was shockwave therapy, which can hurt somebody if it's done on the wrong diagnosis, which is exactly what happened. I'm not really sure why you don't have to have a license to use shockwave therapy, but I looked into it and you don't. And they hurt this lady's shoulder because they were doing it for the wrong diagnosis. But they're not licensed. They shouldn't even know what the diagnosis is.
I was going to say, how would they even know what the diagnosis is?
They don't know what they're doing. They have no business using that equipment.
Yeah. Well, that's also part of the issue too. The main thing, like PTs have been trained to diagnose.
Yeah.
So have plenty of medical doctors.
Yep.
But all these other people out there, they don't have the education to do that. And this isn't something you pull up on Google.
Right.
So.
And the problem is, and I've worked with people who have said things like, well, I know all the things you know, I just don't feel like going to 3 more years of school. And the problem with that statement is that they don't know what they don't know. So like I work with a lot of athletic trainers, and I don't know where the line is between what I know and they don't and what they know and I don't, because I've not gone to athletic training school. So I don't know what I don't know. And I'm sure I don't know a lot. The problem is when people don't know what they don't know and then present it as if they know stuff. So if you want to present yourself as being a licensed practitioner, go through the work and get the license. Otherwise, just say what it is you can and can't do, and sell yourself on your merits, on what you feel like you're good at.
I concur.
Is there more for today?
I don't think so. I think that's it.
All right.
I think we've probably
click that like and subscribe button. It's down there somewhere.
Yeah, do that. And we'll post notes and everything. And stay tuned for our next episode.
Feel free to give us some advice on what you'd like to see.